He was an idealistic doctor, hungry for fame, who would champion one of the century's most infamous medical procedures.
He wanted to solve the problems of psychiatry, and he wanted to do it fast.
The lesson here is not how a man can go off the rails, but is how science can go off the rails.
The lobotomy, a brain operation in which a surgeon would cut the connections between the cortex of the brain's frontal lobes and the lower centers of the brain.
The procedure became kind of a catch-all solution at American psychiatric hospitals for a multitude of symptoms, including disorientation, insomnia, anxiety, phobias, and hallucinations.
He would get his ice pick and a hammer, and he would go into the brain through here. He's going in here. Yep, going through, going about 5 centimeters, and then you just squiggle it around. And then out it comes. And according to Freeman, the only post-operative care the patient needed was a pair of dark glasses.
He would just lift up the eye and stick nothing more than an ice pick right into the brain, right under the orbital bone, and then just rake the thing back and forth until he was satisfied that he had caused enough disruption of brain tissue, and then pull it out.
In 1848, a genial chap named Phineas Gage was working on the railroad, tamping gunpowder into a blasting hole with an iron rod when the gunpowder ignited. The resulting explosion caused the rod to shoot like a bullet up through his left cheek and out the top of his head. After a few months of convalescing, he was pretty much healed up and moving around like he used to. But some of his friends were saying that Phineas was no longer himself.
Psychologist Mary Frances Robinson assessed 90 patients who received lobotomies and discovered that most of them could no longer concentrate. They appeared unmotivated and lost interest in their own lives.
Once the connections between the frontal cortex and the limbic system are gone, the limbic system is free to fire its messages of emotion uninhibited by the frontal cortex, and behavior becomes erratic and unpredictable.
These huge black cavities were created by Dr. Freeman's instruments.
Same as this from a different
And on both sides?
Both sides.
Right. So what would that area normally be doing?
So the frontal lobes are important for long-term planning, inhibition of a response. One of the most obvious things that people who have damage in this part of the brain is they become very impulsive.
By the time his surgical privileges were revoked after his last patient died on the operating table, Freeman had performed or supervised over 3,500 lobotomies, more than 25% of which, by his own admission, left his patients in a vegetative state.
I completely shudder from head to toe. And that's what I heard in my head when he drilled something in my brain. And nobody has the right anyway to play God with somebody's brain.
Transorbital lobotomy. A false hope for grossly disturbed patients. A barbaric therapeutic procedure. A cause of epilepsy, severe brain damage, and even death.